Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, October 18, 2022. And as always, I want to thank you for joining our Facebook Live. This is your opportunity to get your public health questions answered. Of course, we are taking COVID questions or monkeypox questions or any other infectious disease questions. But we've also been really broadening this each week to bring in other people working in other areas of public health to help you learn a little bit more about the work of public health in Chicago and to take your questions. So we are joined today by a special guest who actually told me it's her first time on Facebook Live, which I was surprised to hear. This is Megan Cunningham. She is the Managing Deputy Commissioner at the Chicago Department of Public Health. So that's really one of our highest leadership roles. And Megan, why don't you go ahead and tell folks about the Bureau you oversee and a little bit about your work and then what we're going to be talking about today.
Sure. Thanks so much, Commissioner. And good morning, Chicago. That's kind of fun to say. So my name is Megan Cunningham, and I am a Chicagoan born and raised. I grew up in the Rogers Park community area, and I've had a meandering path to public health, actually, sort of a non-traditional path to public health. I've been a public school teacher in Newark, New Jersey. I taught 6th grade language arts literacy. I went to law school and had a real passion for public interest, and I've worked in everything from prison reform to environmental justice, and ultimately took a job with a group called the Camden Coalition of Healthcare Providers, a nonprofit organization based in Camden, New Jersey, focused on really thinking about how we deliver better and more comprehensive care to some of the city's most complex residents. And what I've learned about myself in this kind of meandering journey is what I'm most interested in is how big systems, big public systems, can be organized in ways that either serve people well or continue to perpetuate disadvantage and oppression. And I wanted to dedicate my career to working towards increasing opportunities and access to healthy environments for all. So there was no better place for me than at the Health Department.
All right, and tell folks a little bit about the area you oversee, how long you've been with us, just a little bit about some of the kinds of work that you do.
Yeah, so I joined CDPH as Managing Deputy Commissioner back in 2016. In a time of COVID, my whole world, as with everyone else's, kind of shifted, and for a time I was responsible for quarantine and isolation facilities during our COVID response, with a particular focus on how do we protect people experiencing homelessness and building systems of care and prevention within shelters as well as within our quarantine and isolation units. Now, my focus at CDPH is within our newly formed Bureau of Community Health, where we really focus on the root causes of health. So how do we build partnerships with community residents to really inform and to lead and to drive locally owned solutions to health and racial inequities? We lead our planning processes at the Health Department. I'm sure you've talked at great length
Healthy
on Facebook
Chicago
Live about Healthy Chicago 2025, our current plan to close Chicago's racial life expectancy gap. So our planning unit oversees that, as well as our Healthy Chicago Equity Zones initiative to partner with communities in the implementation of those strategies. It also includes our Office of Chronic Disease Prevention and Health Promotion, which works on everything from heart health to diabetes to expanding access to health care and treatment services with a particular focus on community health workers. And it includes our Health Equity in All Policies team, which is really deeply focused on how do we drive collaboration between the Health Department and other city agencies and regulatory bodies that have so much impact on health, from Department of Transportation to Planning and Development to Public Safety. We really try to support other departments in thinking with a public health lens. And finally, our Office of Population Health Epidemiology. So not the epidemiologist focused on any one particular condition or population, but really the group looking at the wellness of the whole of the city of Chicago and neighborhood level conditions. So it's a really exciting job, and I feel very fortunate to be at the Health Department doing this work at this moment in time.
Perfect. So sometimes we get comments, boy, it seems like the health department works on everything. And we don't work on absolutely everything, but there are a lot of things. You know, health is so all-encompassing, and Megan's bureau really does a lot of that behind-the-scenes work. Today, we are going to have a particular focus on the environmental health, the environmental permitting and inspections that really live within the Community Health Bureau that Megan oversees with quite a large team. let's go ahead. As always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on Facebook or Twitter. We'll use about the first half of our time looking at the COVID dashboard, doing a little bit of an infectious disease update, and then Megan's going to do an overview of what does environmental permitting inspections, what is environmental justice at CDPH mean anyway, just to level set a little bit. And then we'll use the second half to take your questions directly. So let's start with the COVID dashboard. CHI.gov/COVID-, as always. And if you take a look here, things are still looking pretty good in COVID land in Chicago. We remain at a low community level. We are averaging over 300 cases a day. There was a point where we were under 300 cases again recently, and so it's up just a little bit, although down from last week. Hospitalizations up also just a tiny bit, still averaging every day 22 Chicagoans being hospitalized with COVID, and then we're having about 3 or so deaths from COVID every week in Chicagoans. Doing around 5,000 vaccinations a day. Our emergency room visits are very good. Less than 1% right now are folks coming in with COVID, and about 3.2% of our hospital beds are currently taken up with patients who have tested positive for COVID. So, continuing at a relatively low level, but the concern is that as cold weather is setting in, which it really has this last week or so, that's when we typically see respiratory season really take off, and that's the concern. So I'm going to go ahead and pull up just some slides here. So first of all, related to Chicago being at a low community level, we are, for both the city of Chicago and for Cook County, we are doing well here. This new case per 100,000 population mark for over 7 days, we want it to be under 200. You can see it's well under 100. Our new admissions per 100,000 in the middle, we want it less than 10. We're well under that in both settings. And then we want the percentage of staffed inpatient beds to be less than 10%, and we're well under that. And in fact, the U.S. overall has been doing quite well. Using these same metrics across the country, just 2% of U.S. counties reported a high COVID community level last week. Those are the counties in orange on the left. And then 18% reported a medium level. Those are the counties in yellow. And on the right, you can see that all of Illinois, every county is now in either a low or a medium level. So that's great. It doesn't mean COVID is gone, but it means that we're not seeing significant strain on the healthcare system. It means that the vaccines are doing well. And generally, we're not at a point where we need to have major disruption. And the goal, of course, is to never have major disruption again, which is why we care so much about everybody getting their updated fall 2022 COVID booster. All right, here's the variance updates. And I know those of you who follow closely watch this pretty carefully, as do we. Still, the huge majority is this BA5. 72% of our cases in Chicago across the Midwest are that turquoise color of the BA5. And then above that still is the BA4. But you can see there are increasingly some new subvariants. BF7 was showing up a couple weeks ago. This BQ.1 in the green is growing. All of these are still Omicron, and that is the most important thing, because as long as they are Omicron, the updated COVID vaccine for this fall, the way it has been updated is that it better recognizes the spikes of the Omicron subvariant. So I don't love to see variants emerging always, and we're not in quite as stable a place as we were 6 weeks ago, if you look back across this chart. But the best news is everything is still Omicron, and so getting your fall 2022 vaccine should give us that extra protection we're going to need against Omicron. And remember that the updated variant, it's specifically good for the BA4, BA5, which is more than 80% of what we're seeing right now. So related to the updated COVID-19 vaccines, I know a lot of Chicagoans are still a little confused about this, because I talk to people every single day all over this city about COVID-19 vaccines. And let me just hit a couple of quick points. First, do I need this updated booster if I had a COVID booster in the past? Yes, you do. This updated booster, made specially for the fall of 2022, is the first time we've adapted the vaccine to better fight off the Omicron variant. So if it's been at least 2 months since your most recent COVID vaccine, you should get this updated vaccine, and you should get it now. You should not wait until a potential surge in November or December. And then the exciting news is that the new bivalent COVID-19 booster for kids age 5 to 11 is now here. So I know some of you were impatient for this. We had the updated booster for adults roll out in September. But just last week, CDC updated the recommendation. So fall 2022 COVID boosters for children ages 5 through 11. Let me just put a little context around this. We've given more than 12.7 billion COVID vaccines around the world, saving countless lives. There has never been a vaccine more carefully studied, followed up. The excellent safety and efficacy profile remains. We've given 5.4 million vaccines here in Chicago, and I am so pleased that now there is both a Pfizer and a Moderna fall 2022 pediatric booster. I want to remind you, these boosters use lower kid-sized doses than the versions that have been available for adults and older children. And one of the reasons that the dose is lower is to make sure that the younger children have the protection, but without side effects. The most common side effect in the trials of pediatric vaccines, pediatric COVID vaccines and boosters, the most common side effect was none. So really, most children have no effect, and we want kids to get both their updated pediatric COVID booster and their flu vaccine. And yes, you can get them at the same time. So booster eligibility is for all kids 5 to 11 who completed their original primary vaccine series. So it doesn't matter whether you had another booster or not in the past, you should get this one in the fall. And CDPH operated and supported clinics started administering the pediatric vaccine booster this week. It's very exciting. Pharmacies and doctors' offices have also begun. Shipments are still rolling in, and so you may want to check with your pharmacy or your pediatrician to see if they're completely going. But all of the CDPH clinics are up and going. We have almost 100,000, 94,000 Chicago children age 5 to 11 who are due for an updated booster, meaning they had a primary vaccine, but it's been at least 2 months since any prior COVID shot. And if you look at the breakdown of this, 38% of those kids are Latinx, 28% are white, 19% are Black, and you can see the others there. So we are especially interested in making sure that, especially in Latino communities, there are more children there to reach, and so we're working to get that information out. If we look at Chicagoans 5 and up now, previously we'd been talking about Chicagoans ages 12 and up, but of all Chicagoans 5 and up, 3/4, 1.9 million Chicagoans are eligible for this bivalent booster. However, only about 10% of the people who are eligible for the updated fall 2022 booster have gotten it. So we've administered more than 197,000 doses as of last week. So that's not nothing, but it's nowhere near where we need to be protected as a city. One thing I'm pleased about is since authorization, if you look at that red line, it's actually stayed quite stable. Our 7-day rolling average is to do about 5,600 doses across the city every day. And I've been pleased that has not dropped off. It's just that we need to keep that up and ideally increase it even a little more. If we look at who in Chicago has gotten an updated COVID-19 vaccine of those nearly 200,000 as of last week, first of all, you will see that the majority have been white, non-Latinx Chicagoans, 58%, whereas only 16% have gone to Black, non-Latinx, and only 13% to Latinx. So gaps there that we really want to address. Making sure that everybody who is eligible gets this, and we've worked to make sure that every neighborhood has free clinics. We've been working with churches and aldermen and community partners and housing and senior centers and you name it to get this out and available. If you look at the uptake among those who are eligible, just among Chicagoans, I wanted to highlight that among those who are eligible for this group, we're not doing very well in any subset of the city. If you look at white non-Latinx Chicagoans, fewer than 20% of eligible folks have gotten that booster. If you look at Asians, it's about 12%. If you look at Black, non-Latinx Chicagoans, it's about 8%. If you look at Latinx, it's less than 6%. This is not going to be enough to get us through this winter without a likely fairly significant surge. So I'm concerned. And if we look by age group here, not surprisingly, the older Chicagoans are more likely to be vaccinated. But this number is just hurting my soul, that less than 20% of Chicagoans over the age of 80 have had their updated COVID booster, and less than a quarter of those over 70. If you know somebody who is in their 60s, 70s, or 80s, I just don't want deaths. I don't want hospitalizations. We know age is a really important independent risk factor for bad outcomes. I want all of these numbers ideally at 100%, but especially for older Chicagoans, it's critical that we're getting both the updated COVID vaccine and the flu vaccine. And you know, the numbers are really low in the kids. We are already seeing pediatric hospitals like very stretched, and it's only October with respiratory viruses. Getting the fall 2022 vaccine and the flu vaccine for children is also really critical. And I mean, it is for all Chicagoans, but for kids and for older adults is who I'm most concerned about. And the last thing is I just wanted to highlight that, just a reminder, I show these graphs a lot, but I still hear people saying, I don't think the vaccine makes a difference. I'm just going to take my chance. So I wanted to remind you that just since Omicron became dominant in Chicago, so the really bad surge we had last winter, just in 2022, Chicagoans have been 80% more likely to be infected with COVID compared to, those who are unvaccinated are 80% more likely to be infected with COVID compared to vaccinated and boosted Chicagoans. And you can see in this graph here, the red line shows COVID infections in unvaccinated Chicagoans. The light blue line shows COVID infections in people who had their original vaccine but not their booster. And the dark blue line shows people who have had a booster. And if you look at last winter, I want us to look like the dark blue line, where cases stay at a reasonable level. The best way to do that is by getting boosted. And if we look at severe outcomes, it's even more notable. So same colors here, but hospitalization rates have been 270% higher in unvaccinated Chicagoans compared to boosted Chicagoans. Look at last January, this huge spike. This is what was threatening our hospitals. Mostly unvaccinated Chicagoans in red being hospitalized. And that has just continued all the way to the present. So much more likely to be hospitalized than folks who are vaccinated at all in light blue, but then especially those who are boosted. So 3 times as likely this year. And then finally, deaths. Mortality rates are almost 6 times, 580% higher in unvaccinated Chicagoans, again in red here over the last year, compared to boosted Chicagoans. And look at this last fall on the left, last winter in kind of the January, February. We barely saw a bump in deaths during that terrible Omicron surge in people who were boosted, but we saw a terrible surge in the red in folks who were unvaccinated. So it's not too late. If you didn't get your vaccines at all, we would love to start you off now. We'll bring you up to date, but please do not be unprotected against COVID and Omicron heading into this winter, and get your flu vaccine at the same time. So this Saturday, 9 to 2, we will be at both Richard J. Daley College and Wilbur Wright College. We will have COVID bivalent fall boosters for all ages, 5 and up. Bring the whole family. We will also have flu vaccines for everybody. Flu starts at age 6 months. So everybody over the age of 6 months and up should get a flu vaccine. Everybody over the age of 6 months and up should also get the original COVID vaccine, but then those 5 and up should get this bivalent booster. And there's lots of other opportunities available. As you know, we continue to have the big weekend clinics, but we're partnering with all kinds of folks. So look at chicago.gov/vaxcalendar if you want to see when we're going to be near you. This just gives you a sense, high level of what's going on right now. All of these are free, and we'll give you both a flu and your COVID vaccine. We also continue to operate our at-home, 312-746-4835. So if you give us a call, we'll bring COVID vaccine to the whole family. So that's the number, as always, if you have questions. But right now is the time, as cold weather's setting in, that we really need Chicagoans to come up to date with the new booster and get their flu vaccine. And with that, I'm going to hand it to Megan Cunningham, our Managing Deputy Commissioner, who is going to talk about advancing environmental health.
Thanks so much, Commissioner. And I will tell you, I got my booster and my flu shot at a CDPH clinic just a couple of weeks ago, and I feel so much better knowing that I've protected myself and my family for the winter.
Perfect.
All right, so let's shift gears and let's talk a little bit about environmental health. As we mentioned previously, I am the Managing Deputy Commissioner for our Bureau of Community Health. Our Office of Environmental Permitting and Inspections sits within the Bureau, and today we're going to focus on how we are really bringing together the tools, the resources of the Public Health Department to support on leading an environmental health agenda. So let's bring it back to Healthy Chicago 2025. We mentioned this briefly earlier. It is our citywide plan created in partnership with hundreds of community-based organizations, faith groups, academic research institutions, foundations, community agencies, all coming together to really set a vision for the city of Chicago. Our most recent plan, Healthy Chicago 2025, is centered on closing the racial life expectancy gap in our city, which we know now stands at a striking 10 years between Black and white Chicagoans. We've also seen a 10-year decrease in life expectancy from 2012 in our Latinx population. And we know that if we are going to make meaningful change to address that gap, we need to focus on the root causes of health. It's about something more than just people having access to healthcare treatment and having a relationship with a healthcare provider. It's really about the conditions of our neighborhoods. And so when we think about what's driving those gaps in chronic disease, in opioid overdose, in gun-related homicide, or maternal and infant mortality, those gaps are really being driven by the access to resources and opportunities that people have within their neighborhoods. And the environment that people inhabit is a critical piece of that. We know that exposure to pollution has implications for people's heart health, people's lung health. That is a contributor to chronic disease, and that is a contributor to the life expectancy gap. So if we want to really kind of create a more equitable Chicago, a big part of that is ensuring that everyone has access to a healthy environment free of harmful pollutants. We also believe that in order to get at that, it's really not just a permit by permit question. It's about the policies that we have in place as a city. And that's everything from how we plan the use of our lands, where and how, what kind of development happens, to the ways that we regulate those sorts of industries that have the potential to pollute, to the ways that we actually enforce those regulations and ensure that businesses are being good actors in the city of Chicago. And we have to do that policy change work in collaboration with community stakeholders and with industries that are being affected by those regulations or by that pollution exposure. So here is my attempt to distill onto one little slide all of the things that we do to really promote environmental health as a health department. So first and foremost, we are permitting facilities and activities that have potential environmental impacts. So before a company is able to operate or it's able to expand within the city limits, they are receiving permits from the Chicago Department of Public Health. We also conduct inspections. So for the permits to mean anything, we need to actually be out there in the world ensuring that we are holding businesses accountable to the terms and conditions of those permits. So we are out there in the field, and we're issuing citations to enforce the regulations if we see violations. Number 3 is we're actually supporting the collection of hazardous waste and the cleanup of contaminated sites to prevent some of those exposures to more toxic pollutants. And then importantly, number 4 is we're developing policies that are actually then going to better protect human health and the environment. So it isn't just enforcing the laws as they exist today, it's pushing towards more proactive, more progressive policy measures that are really kind of keeping equity at the core. And finally, we're analyzing data and using that data to drive innovation in environmental health. So I'm going to spend just a moment going into a bit more detail about the structure of our unit and then on each of these kind of important pieces of what we do. So here is our org chart. It probably looks very small on your screen right now because we actually have about 52 positions just on our environmental permitting and inspections team alone. And this is a really exciting and important group to work with. They have such important technical expertise. We have environmental engineers, we have environmental inspectors, we have attorneys who specialize in enforcing environmental laws and regulations. And they're organized by various divisions here. So we have our field operations team, we have a waste permitting team, we have our hazardous materials group, our air and asbestos team, our storage tank team, and then our real kind of surveillance and enforcement group. And we'll talk a bit more about each of these functions in just a moment. But for now, suffice it to say that this is a team that is out there every day for the benefit of Chicagoans, working across a real wide breadth of industry types and doing these critical permitting and enforcement activities. So here are just a few examples of the types of facilities that we engage with at the Health Department. It was really interesting to me as I got more involved in this work to know that we actually have teams that are inspecting underground storage tanks. This particularly relates to things like gas stations, where there are the potential for leaks of storage tanks that can create real environmental hazards. So we have a team that is dedicated to the inspection and the response on those tanks. We permit solid waste facilities. That includes things like waste transfer stations and recycling facilities. And then, of course, industrial facilities of all types that have the potential to, and commercial facilities that have the potential to emit air pollution. Overall, we're reviewing on average something like 1,000 permits each year. But CDPH is not alone in our responsibility to permit these types of businesses. So I want to spend just a moment talking about the constellation of other public agencies that are involved in permitting operations. So I spoke just a moment ago and briefly about land use as a critical component of this process. Before a business can operate in the city of Chicago, they need to go before, or certain types of businesses operate in the city of Chicago, they need to go before what's called the zoning board in the city that determines whether that is an appropriate kind of land use for the particular location that they desire to site their business or their entity. And so the Department of Planning and Development, and specifically those focused on zoning within it, are permitting certain kinds of use or approving certain kinds of uses of the land. We work closely with the Department of Buildings. DOB is actually issuing permits related to the construction, the renovation, or the demolitions of the physical structures themselves associated with the site. We also work closely with the Department of Transportation that looks at mobile sources of pollution like trucks, and they're thinking about it from the perspective of traffic impacts on the surrounding community area. And we work with the US and the Illinois Environmental Protection Agencies. They are really tasked with setting the emission standards nationally and at the state level related to the amount of air pollution that businesses are able to emit, keeping in mind sort of health protective standards. The Health Department is delegated by the Illinois EPA to do some of this work, but we also have authorities related to the addressing of quality of life issues that often come into play with these types of facilities. So we have regulations and create permits that are responsive to things like dust or odors or noise, other kinds of day-to-day quality of life impacts that communities may experience, and we want to make sure that we are mitigating to the extent possible through our permitting role. So then you have a business that is appropriately permitted in all of these ways. It's beginning its operations. Our next step is that we are conducting inspections. So on a routine basis, we have inspectors out across the city of Chicago that are actually looking at these facilities, laying eyes on them and making sure that they are being responsible stewards, that they are operating in a way that is consistent with the terms of their permits. And if they are not, we are issuing them citations and we are conducting the next appropriate enforcement steps. We work with the businesses to try to bring them into compliance, to make sure that they fully understand the terms and conditions of their permit and that they are acting in accordance with them. But if companies are not coming into compliance, we do pursue all of the administrative and legal remedies that are available to us. So that's happening on a routine basis every day across the city. In addition to that, we are highly responsive to community complaints. So Chicago residents themselves are sort of our extra sets of eyes and ears across the city, helping to hold businesses accountable and reporting things when they just don't seem quite right. And so this might be anything like concerns related to construction or demolition, issues around air pollution, odor, dust, spills or dumping in waterways, noise, and when I say noise, I don't mean noise just from fireworks or a loud party. Really, CDPH's purview is over industrial equipment noise, so stationary equipment located on these sites. And so we receive these complaints through 311, and in response to both these community complaints and our routine monitoring, overall, CDPH is conducting often 8,000-ish inspections each year of locations across the city of Chicago. So this is an area that I did not know about before becoming more directly involved with our Bureau of Community Health, with our environmental permitting and inspections team. But they are they're very actively involved in protecting all of us from exposure to hazardous materials and waste. So first, I think a good thing for everyone to know about is our household chemical and computer recycling facility. This is located at 1150 North Branch Street. It is a facility available to all of us to drop off things like our household cleaning agents or paints or that old VCR that's been sitting in your garage that you want to dispose of properly. This is the location where you can bring it, and at no cost we will take that off your hands and we will make sure that it is disposed of or reused in a way that is environmentally sound and safe. If you'd like more information about that, you can visit our website on the Household Chemical and Computer Recycling Facility for our hours and more details about exactly what you can drop off. And then we are involved in individual hazardous waste responses. So if there is an incident in the city, for instance, if there is a mercury spill somewhere, or there is a major explosion, your first responders are, of course, things like the Chicago Fire Department. They are there on site to control the situation and make sure that any imminent threat to safety is being addressed. And then our CDPH team is there too. So we are actually evaluating the extent of the incident. We're helping to think about what kind of remediation is necessary. And so CDPH and our contractors are really kind of leading on that phase of the response. We also, interestingly, have inspectors and environmental engineers and experts on toxic chemicals that are actively involved in things like monitoring major events in the city of Chicago. So they are part of the hazmat response for things like Lollapalooza or the Chicago Marathon. And finally, we do have sites across the city of Chicago that, because of their historic uses, have been contaminated with certain types of pollutants. And we work with all of the other state and local and federal agencies to identify these sites, to create plans for remediation, and to secure resources to get that work done. Okay, so everything I had talked about to this point was really related to ways in which CDPH enforces the laws as they exist today. And that is, of course, an essential part of the work that we do. But beyond that, we know that even with the laws as they exist today, we still see this racial life expectancy gap, and we still see these stark inequities between the north side of Chicago and the south and west sides of Chicago. And so we're thinking all the time about how do we improve our environment across the city, and specifically, how do we ensure that community areas that are most vulnerable to the effects of pollution or who live in closest proximity to this industrial development are being fully protected. And so we continue to push towards policies that are really designed with an eye towards equity, with an eye towards ensuring that we are using the best state of technology, state of the science, state of the industry to continue to strengthen these standards that protect public health and the environment. So here are just a few very recent examples. In 2019, we issued new rules for bulk storage facilities. In 2020, we strengthened our rules for large recycling facilities. And in 2021, with the passage of the Air Quality and Zoning Ordinance, CDPH actually, for the first time, is now involved even at the point of some of those land use and zoning decisions. So we have created new rules for companies to conduct an air quality impact evaluation at that point of zoning to really model what would the impact on the neighborhood be. And we share that information forward to the zoning board to inform their decision making with CDPH's recommendations. So, all of this is evolving, right? The policy landscape continues to push forward. We continue to work with industry and with communities to think about how we enhance these rules in these sectors and in others. And this is a very exciting part of the work of the health department. And then finally, as with all things at CDPH, we are committed to our data. And Commissioner Arwady is out here every week talking about the ways in which we're using data to lead on our COVID response or things like monkeypox. But we're also using data at the core of a lot of our environmental health agenda. So here are just a couple of quick examples. I think our Director of Environmental Innovation, Raed Mansour, was a participant in this program just a few months ago, talking about our tree equity work. And really, what was the beginning of all of that was the creation of what we called our tree equity tool. And that took together and overlaid information about existing tree canopy, surface temperatures, social vulnerability factors, and it created this map that you see at the upper left-hand side of your screen that gave us ideas about where planting trees would have the most positive impact in the city of Chicago, where trees are most needed. And that has now driven the entire Our Roots strategy for equitable tree planting across the city. Similarly, we have been working with academic partners from Microsoft and from various universities and with community-based organizations on Project Eclipse. So this is an effort to get more real-time, hyper-local data through 100 plus sensors across the city of Chicago. All of this information is open source, available to you if you search for Project Eclipse online. You can actually see what's the air quality today in your neighborhood. And we're using this data to inform more real-time responses when we see air quality spikes or concerns around the city. And we'll continue to grow that body of data through some of our future work. Okay. Healthy Chicago 2025 is a plan that gets explicit about race and structural racism. And so as we think about our environmental health work, we also want to be explicit about environmental justice and to make some real commitments to the way in which we will advance environmental justice through our activities. So here's an outline of some of what we're doing. First, we're expanding opportunities for public engagement. And this is really about transparency in our decision making, and it's about listening to community voice and lived experience. And that's on everything from concerns or complaints related to sites, or also just prospective ideas for how businesses and communities can coexist across our city. So we've recently expanded our public engagement guidelines that used to just refer to our large recycling facilities. They now actually encompass all consequential facilities, including things like rock crushers or waste transfer stations. And this is part of our commitment to really engaging in a productive dialogue with neighborhoods as we want to hear that community voice to inform our permit decision making. Second is we're really going deep on advancing health equity in all policies with other city departments. So we are working all the time now with the Department of Planning and Development on things like thinking about some of their industrial corridor modernization work or the We Will Chicago planning effort with environment and sustainability in mind. We're working with CDOT to think about the health implications of fleet electrification and where they should begin electrifying our city buses. We're working with public safety to think about tree planting as a violence and public safety effort in the city of Chicago through greening of vacant lots. So that health equity in all policies work, it extends from the way that we do our contracting to the way that we're making investments in programs to ultimately policy change. And we have a team now at CDPH working with environmental permitting inspections, working with other city departments to bring a public health lens into the way that they do their work. We are also emphasizing our partnership with the Illinois and the US EPA on policies and targeted enforcement efforts. We do, as you saw on that permitting slide, we all kind of have a hand in this. There's this complex relationship between these various entities, and we want to do a better job of working together to identify sites that need more attention from an enforcement perspective and to move that forward. And we will continue to use innovative data and assessments to improve our understanding of how local environment affects health. And that's not just a plan on paper, it is a plan in action, and it's a plan with real resources behind it. So thanks to the Lightfoot administration and the Chicago Recovery Plan, we now have $30 million in American Rescue Plan and bond funding that is dedicated specifically to some of these environmental justice programs that CDPH will administer. So we are leading on a first of its kind for the City of Chicago cumulative impact assessment, which we can talk a little bit more later if folks have questions about. We are expanding and building upon that local air monitoring network that we mentioned, through Project Eclipse and some other initiatives like Shared Air, Shared Action. There have been efforts to get these low-cost sensors across the City of Chicago to create a better picture of air quality at the neighborhood level. We want to continue to grow that, and we want to do that in close collaboration with research entities and with community stakeholders. And to do that, we are going to actually award environmental justice community partnership grants. So for the first time, we will fund some of these neighborhood environment-focused organizations to really kind of work hand in hand with the city to envision and to drive strategy around each of these initiatives. And finally, we have funds set aside to do remediation of polluted sites, particularly in overburdened areas. And a good example of this is the Shroud site on the southeast side of Chicago, where there had formerly been a steel mill. There had been a lot of dumping of the steel waste byproducts. It is a contaminated site now, and we are working closely with other regulatory agencies like the EPA on the remediation of that site, and we'll be working with community partners to choose others in the city to work on as well. Okay, so that was a lot about what we're doing. So we now want to talk about ways for you to get involved, specifically in some of these permitting and policy steps. So in addition to the work that you can do in your own life to really promote the environment or work through Our Roots Chicago campaign to do things like planting trees, here are some ways that you can get directly involved in some of CDPH's actions around permitting and policy making. First, as I've said, we are really committed to being more transparent and more engaged with community stakeholders affected by our decisions. So we've created now on our community information page a place where you can quickly and easily sign up for updates from us. So if you log on to the website that we're displaying here, and note that this is a case-sensitive website, we're going to try to fix that for you so it's a little easier to find. You can sign up you just put in your name, put in a little bit of your contact information, and we will send you news relevant to your community. We've also talked a bit about the importance of everyone being kind of extra sets of eyes and ears across the city to report environmental issues as you see them to 311. There is a fact sheet on that community information page that gives you some more detail about how that process works, what you can expect, and what information we need from you. And if there are questions today, I'm happy to talk in more detail about that too. And finally, of course, we need everybody to show up, really attend community meetings in your neighborhood. When there are opportunities to submit written comments on regulations or permit applications, we read every single one. We respond to them as part of our permitting process, and it helps us so much to do our job in a way that is more responsive to community. So that is just a little bit about our environmental health agenda, and glad to take further questions to the extent that there are any.
All right, thank you, Megan. So lots of information there, but we've gotten so many questions sort of over the last few months about environment that I wanted to really devote some notable time. So while I pull up questions from the watchers, could you actually just start out? Already somebody's interested in this. What is this cumulative impact? Like, what are you talking about? How does that fit in? And then I'll get to the rest of your questions.
Yes, thank you for that question. So historically, the way that we have thought about permits is on a sort of one-off, case-by-case basis. So we look at the impact of an individual site on the neighborhood. We compare it to existing standards for things like emissions, and if it falls below the acceptable level, then we permit a business to move forward. What we have come increasingly to recognize, and what community environmental justice stakeholders have long been calling upon the city to do more of, is understand that none of these single permit decisions exists in a vacuum. It's really about understanding collectively the impact of all of the businesses in, for example, an industrial corridor, and how much collective exposure is that creating, how much collective burden in terms of some of these quality of life concerns around noise and odors and traffic is a community experiencing. And so we are part of what is now a national trend towards increasingly embracing a cumulative impact approach to our policy making. And that means that we need to start from a place of having better data. So public health is working with the city's Environmental Equity Working Group, which is a set of partners from neighborhoods across Chicago, experts in environment and sustainability, who are helping us to really design and carry out this assessment. We have working groups dedicated to data and methods, dedicated to communications and public engagement, dedicated to this forward-looking policy making. And we together have embarked on this assessment process, and we remain on track to publish our assessment findings by mid-year 2023. And the hope and the intent is for that assessment then to be the driver of some of this proactive policy change in everything from thinking about land use to thinking about permitting and enforcement policies, changing the way that public health does our practice, but hopefully also offering this up to other public agencies for them to take action on as well. So we're grateful to all of the partners who are involved in this work. We think it has the potential to be truly transformational as we think about, how do we do this complex balancing where we know we need economic development in the city. We know that that is itself good for health, for people to have access to well-paying jobs. But we also know that we need to be appropriately weighting that against the impacts that communities are experiencing on health, on the environment. So we need to bring that cumulative impact information into that conversation so that we can make informed choices about how development happens going forward.
All right, great, thanks. I've just been bundling your questions a little bit by category. So I'm gonna take some COVID ones and then we'll come back. So a number of folks commenting that the mayor posted about getting her flu and COVID shot this weekend. If you didn't see it, I gave her vaccines as I have all along, and we did one flu vaccine in one arm and the COVID booster in the other arm. So Chicago Contrarian on Twitter is asking, wasn't at Chicago's mayor vaxxed and boosted when she contracted COVID in January, and why is Dr. Arwady wearing a mask, presumably in the pictures of me giving the vaccine? So, of course the mayor has been up to date with all of her vaccines and boosters. When she got a case of breakthrough COVID during the Omicron surge, she was right in line with so many other Chicagoans that also we've seen breakthrough COVID in. You've heard me say this once, you've heard me say this 100 times. There is no such thing as a 100% protective vaccine. But the reason I showed you those graphs is because the vaccine is the most important thing to prevent infection, but more importantly, to prevent severe illness, hospitalization, and death. When I hear that someone has breakthrough COVID, my first question is, are they up to date with their vaccines? If they are, I do not have a high concern for them getting hospitalized or even potentially dying. And then in addition, we also have treatments available now. So if anybody gets COVID, whether or not they are up to date with their vaccines, we want them to get Paxlovid or the other treatments. And the other point on this is that one of the reasons Omicron surged so much was because that variant was really genetically pretty different from the variants that had come before. And so the exciting news is that this fall's 2022 booster is the first time the vaccine has been updated. All the times before this, the original vaccine, the original booster that not just the mayor, but thousands of you got, those were all designed just against the strain of COVID from the beginning, the one from Wuhan in 2019. This fall, in the same way we make a flu vaccine every year to fight off the strains of flu that are circulating every year. That's part of why you need it every year. This fall's COVID booster is the first update specifically to fight off Omicron. And so, while it will both give you the boost to help keep you out of the hospital, keep you from dying, we're also pretty confident that it will help even more with those breakthrough infections too. And the question of why am I wearing a mask when I am vaccinating the mayor? So that is a healthcare interaction, even if I am doing it in her office, and we believe in wearing masks in healthcare interactions. Couple more COVID ones here. So Michelle Lynn from Facebook, are flu season hospitalizations anticipated to be worse this year with COVID subsiding somewhat? So I don't have a crystal ball to completely know what's going to happen with this flu season, but you've heard me say, and nothing has changed my mind on this, that I am anticipating quite a bad flu season. That is, number one, because we haven't had as much of a flu season for the last couple of years because of the masking, because of kids out of school, whatever it might be. So we are seeing more germs just right now anyway. We always have a flu season. It's never like we don't have a flu season, but in terms of how bad it will be, the Southern Hemisphere is our best our best way to predict on that. When the Southern Hemisphere, which has the opposite winter-summer pattern that we do, has a bad flu season, in their winter, our summer, usually the season that comes next, our winter, is bad. And Australia has had the worst flu season it's had in 5 years. The levels have been quite high, just as one example. And the thing with COVID subsiding, COVID, I'm so pleased that COVID is at a low, I want COVID to stay at a low community level. I would be the happiest person alive if we made it through this winter staying at a low COVID-19 level, but I don't think it's likely to happen, just so you know. I think we're likely to see some increase in COVID cases and probably some increase in COVID hospitalizations and deaths, especially in people who are not up to date with their fall 2022 booster. And the question will be, as these come together, what kind of threat will that be on the health system? So you've probably seen some of our messaging. The combo you don't want is the flu and COVID at the same time. And so we don't know for sure, but we do know that the pediatric hospitals are already pretty full just from the other respiratory viruses, and getting both of those vaccines is important. Thomas Patrick from Facebook, are there any side effects with COVID vaccines for children long term? No, nothing that we've seen. You might recall very early on with the very initial vaccines, especially in the youngest teenage boys, there was some extra attention around what's called myocarditis, which is it's an inflammation. You can have an inflammation of the heart muscle. People, recover from it. The inflammation comes down, but it was this sense that perhaps in younger boys, there may be some more just inflammation overall. And so in that setting, they made some changes around recommendations of timing, et cetera. And actually one of the reasons for the decreased dose for younger kids has been to avoid that. So no, we have not seen side effects for COVID vaccines for children long term. We have not seen side effects for COVID vaccines for adults long term. More than 12 billion vaccines, amazing safety and efficacy profile. And then I'll take one more kind of COVID and we'll go back to environment in a second, because you do have a lot of questions there. DS Shin on Facebook says, I'm seeing so many reports on new variants, it's hard to keep up. XBB, BQ1, which are you most concerned about right now? And is there a reason we're seeing so many new ones pop up when we didn't have this many over the summer? So I like this question because, first of all, to take the second part, why didn't we have this many over the summer and we're seeing more now? The way COVID, like any other virus, mutates, creates new variants, is by spreading. Every time there's a new COVID infection, there's an opportunity for the virus to mutate just a little bit in the genetics of it. And when we start to see more COVID infections happening, we also start to see more variants. That's just how it works. So the fact that we're heading into colder weather, it doesn't surprise me at all that we would see more mutations sort of as we head into the cold weather. The good news though, and to the first part of your question, how do we keep up with all of these variants? All of these variants, at least the ones that are showing up at any significant level at this point, they are all subvariants of Omicron, and that's important to understand. Omicron hit us hard last winter, and everything we've seen since, BA4, BA5, BA2, et cetera, et cetera. Even the 7 one. These are all subvariants of Omicron. And so I don't like to see new variants at all, but the one I would be really worried about is a variant emerging that is not part of Omicron, because that's the real question in terms of major lack of predictability. With Omicron, we've got an updated vaccine that actually works pretty well for Omicron. We've got treatments that work really well against Omicron. We have a lot of population immunity against Omicron at this point. Most people have had a vaccine or an infection or both with at least an earlier version of Omicron or the vaccine against it. So I am less worried about these little ones, although I don't love the more rapid increase, and I'm more concerned if we start to see something emerge in the non-Omicron. Remember how we used to talk about Delta and Alpha? That's what we're talking about. It's been Omicron for a year. Okay, let's come back and get some environmental pieces here. So if I call 311, how do I know what happens? What's the time frame in which CDPH will investigate? Good question.
It's a good question. So this is an area that we are really very focused on. We understand that there is a need to respond timely when we get complaints through 311. So here's just a little bit about the process. So in order to actually make a complaint, we invite you to report at 311.chicago.gov. And again, there are certain sort of set of complaint types that we respond to, specifically related to construction demolition, air pollution, odor, dust, spills or dumping, industrial equipment noise, illegal removal of asbestos in multifamily and commercial and industrial facilities, and then dumping of chemicals. So those are the kinds of things that CDPH responds to. So if you go to 311 and you make this complaint, you will get a service request number, and that is unique to your specific request. And that's going to allow you to track throughout the process. Typically, on average, CDPH is responding to these requests within a couple of days. More than 50% of our requests, we actually dispatch an inspector within 24 hours of receiving the complaint. And when it takes longer than that, it's often because we did not have sufficient information or detail in the complaint itself to be able to respond right away. So we have to actually go back to the person who made the service request and ask them some further questions to understand what the location is or what exactly they may have seen. Right. So you can then use that number, you can track it through the 311 system, and ultimately you can go to the city's data portal. It's data.cityofchicago.org, and you can see the full resolution, including inspection reports and things associated with your complaint. So we really do try to be as transparent as possible to say, you know, how long did it take to respond and what was the outcome.
All right, perfect. So here's one that's sort of in the environmental space, but kind of between us. So Francie Swidler on Facebook says, I know you said you would address this week. Yes, we will, but wanted to repost the question just in case. I saw a report that a cancer-causing chemical being sprayed on our produce is at its highest exposure here in Illinois. What kind of risk comes with that, and should I be worried? So for those who haven't been maybe following this story, this is related to a chemical that is found in a lot of pesticides, especially like Roundup, for example, is you may know it as a very frequently used sort of weed killer and pesticide. And there was some analysis that looked to say, you know, where do we see this chemical being used? And it is used quite a lot in Illinois because we grow a lot of corn and soybean here in Illinois. I want to just make sure to put it in a little bit of context, though. So the chemical itself, there's actually some debate about whether or not it is actually linked to carcinogenic risk. And I know this can be a little frustrating for people where it's like, how do you just not know? But there have been a number, you know, people have been looking at this for a long time. And so there was an agency in France that came out and said, yes, we think there is a potential link here, especially to a kind of cancer called non-Hodgkin's lymphoma. And so if there were farmers or people who were really working every day with this chemical, there's been some work to say, you know, is this cancer causing for people who are using it very, very frequently, spraying it every day? And that's one of the things that is, you know, there's some lawsuits and other things around that, which, you know, these are exactly the sorts of things you want to understand. Exposures in the workplace that may have a negative effect. But I do want you to know that, like, the U.S. EPA at this point has not found it to be cancer causing or carcinogenic. A number of other agencies have not. So it's one of these areas that is really still under investigation. But in terms of what does this mean for you, what do we do about this? First, I would just say, if you are somebody who uses weed killers, you know, anything like that, you follow the instructions on the bottle, okay? Like, those are on there to help make sure that, you know, if you should be wearing gloves or you should be diluting. Like it's really mostly about people who are having a lot of exposure to the actual pesticide. So whenever you're using a chemical, read the directions, call the manufacturer if you have questions. That would be one thing. For those of us who are eating the corn products, the soy products, etc., you know, I would say, based on what I know about this, you know, it is a low risk. I would not say it's a zero risk, right? It's something we're looking at, we're understanding, but it's not something that I personally have changed my behaviors or my purchasing materials around. People who do have a high level of concern about this, I would encourage you, you know, if a product is organic, for example, then you're not allowed to use these kinds of pesticides as you are growing it. It doesn't mean it completely eliminates the possibility of exposure if, for example, you know, that pesticide was on the ground below the plants before the plants were used, et cetera. But I just, in terms of a concrete thing you could do, if this is something you're very worried about, you could think about buying products that are organic, which one of the agreements is to not use these as much. But honestly, if you're worried about cancer-causing food, I'm not so worried about your plants. I'm more worried about some of the meats, the processed meats, right? We love processed meats in Chicago, and it's fine to have processed meats. But if you're eating a lot of processed meats all the time, those actually have been known to increase the risk of cancer. And so, what I don't want people doing is say, oh, I'm worried about the plants. Like, let me eat more meat to try to reduce cancer risk. We know that people who follow vegetarian diets actually have lower cancer rates overall. So I hope that helps put it in some perspective for you. It's something that I think is still being learned about. The larger concern, it might be on people using these chemicals every day. And at an individual basis, I would just say, also if you're harvesting anything, wash the produce before you're eating it. And then I think the risk at the general population level in things that are packaged would be quite low. But do some more reading if you want to learn about how to really eat healthily and reduce your risk of cancer. But more plants, less meat is probably more important in that quest than the specifics of this. So thank you for that question. All right, and I'm going to take one more here, an unrelated one. Susan Johnson from Facebook says, Chicago, Illinois is in the list of 5 cities with the largest Ugandan population. Not actually sure that's true, but are we testing, screening, or quarantine for Sudan Ebola at O'Hare International Airport yet? Okay, great question. So let me, if folks haven't been following along, I know there's actually been some misinformation questions about that. I am not sure if we are one of the cities that has the largest Ugandan population. I will look into that. But what I do know is that we are one of the 5 cities that has the big international airports. And so pretty much whenever there is an infectious disease outbreak of significant concern sort of somewhere in the world, there's what is called funneling, and that has happened for Ebola. There's an Ebola outbreak happening right now in Uganda. It's a different strain of Ebola than what we saw in 2014 to 2016. So as Susan says here, it's the Sudan Ebola strain. That outbreak is entirely contained to Uganda right now. There are no cases of Ebola in the US. There are no cases of Ebola in Chicago. But because Ebola can be a big deal. It has a high fatality rate. If people do get infected, it certainly has the potential to, disrupt things. The U.S. has made the decision to funnel any traveler who is coming from Uganda through 5 airports. So first, anybody leaving Uganda, they get screened on the Uganda side. And I just want you to understand, controlling Ebola, the most important thing is getting resources to Uganda. Get it controlled on the ground there. But anybody who's leaving, coming to the U.S., has to get screened. And a couple things just on background. Ebola is not spread via air, so it is not like COVID. It is spread through direct contact. So in case somebody does have symptoms, as long as you have good personal protective equipment, you're in pretty good shape there. So it's not spread through the air. It also is not spread if somebody is not having symptoms. So if somebody does not have a fever, they will not spread Ebola by and large. So again, different than COVID, where people can spread it before they get sick. So those are 2 good things. And so we screen, do people have symptoms? Have they, been in close contact, healthcare setting before they leave Uganda? Then people flying from Uganda have to come initially into the U.S. through one of 5 airports, O'Hare being one. At the airport, we screen, again, anybody who had travel through Uganda. It's basically, have any symptoms, check a temperature, and then a very quick set of questions about if they were in Uganda, where exactly were they? Because it's also just in one section of Uganda. Were they in a healthcare setting? Did anybody, other things that sort of assess risk factors. And then assuming they're well, they are then able to travel on to their final destination, wherever it is in the U.S. Also, though, we get all of their contact information, and then health departments all over the country follow these folks for 21 days. So whenever people, whether they come in through O'Hare or not, if they've been in Uganda in the last 21 days, the health department gets their contact information, and we reach out. We have an initial conversation, and then depending on the level of risk, for those 21 days, we are keeping track of them. That is mainly in case they were to develop potential symptoms, in which case we have an excellent plan in place. We have hospitals that know how to safely isolate and test to rule out Ebola. So I just want you to understand that we are not testing anybody for Ebola. You cannot test people for Ebola without symptoms. We are not quarantining anybody. We are monitoring travelers. And this is something consistent with what we did in the Ebola outbreak back in 2014. So thank you for all of that. Yeah, and there's just a second question here. I'm hearing there were 2 people in Chicago with Ebola. Is that true? That is not true. There are no people in Chicago with Ebola. There are no people who have been admitted to a hospital to be tested, to be ruled out for Ebola. There is no concern for Ebola in Chicago at this time. The health department is successfully monitoring a small number of people who have been in Uganda. And if you have other questions, we can talk a little bit more about this next week. This is very standard preparedness for us. This is my excellent emergency preparedness team. We will 100% let you know if there are any concerns related to Ebola. But part of the reason to track travelers like this is that if they get sick, we know how to take care of them in a way that doesn't protect the public's health. And we know who's been in Uganda recently, so there's not, you don't have to worry about somebody, I got a call the other day. Should I be worried that someone with Ebola is coming into my shelter? No, because we are following all of those people individually. So thank you for that. We are just about at time here. I feel like we didn't. I'm going to give you one more really quick one, okay? And then maybe I'll take one more here, and then we're going to end. Is it your goal to shut down businesses with all of these stricter rules and permitting? The city needs to recover economically from COVID. It seems like environmental protection gets in the way of that. Just a quick answer. I know it could be a long one.
Yeah. So let me tell you, what we are in favor of here rather than what we are against. What we are in favor of is a strong and robust economic recovery for the city of Chicago. Yep. We are in favor of being host to businesses that are going to be good neighbors to our communities, that are going to follow our laws, and that are going to work with us to continue to enhance environmental controls and protections. So we are welcoming and encouraging of business partners here in the city that want to work with us along those lines. What we are not in favor of is allowing businesses to operate in ways that are irresponsible or that are not sufficiently protective of human health and the environment. And so that's why we continue to ensure that we are enforcing our laws and regulations. But we absolutely acknowledge the importance of economic development to health, and we want to figure out a way to do this in partnership with community and with industry so that we can all thrive.
All right, great. And then the last little set of questions I'm going to take is around the mask requirement for healthcare facilities. Some of you noted some changes in that in Governor Pritzker's most recent emergency declaration. So we've got Catherine Welch on Facebook saying, good morning and thank you for the forum. When flu and COVID are projected to rise in coming months, how is the decision to drop a mask mandate for healthcare facilities determined? We've got Katie Schweinfurth on Facebook. Is Chicago going to follow the new masking guidelines for hospitals mentioned by the governor? And Thomas Patrick on Facebook, can you explain the CDC definition of high community transmission? So I'm going to get all of these together. So first of all, one of the things that I think can be really confusing for folks who are not following this closely is that everybody has gotten used to high, medium, and low, COVID community levels. There is a separate set of transmission guidance that CDC has, if you want to go to the CDC website and look at it, that is specifically around the risk for healthcare facilities. And it uses different metrics. It has to do with threat to the healthcare system. And so there's some more details within it, but the region can be high or substantial or lower. So we are not at high right now, but we are at substantial, just so you know. And you can check the website if you want to read some more. So basically, in the governor's most recent emergency order update, these are additional requirements when we do this that that the state is deciding to implement sort of above and beyond what may be required nationally. And so the Illinois' masking guidance for healthcare facilities with this order, they basically defaulted to CDC guidelines. So under current CDC guidelines, masking is required in healthcare facilities if the county in which the facility is located is at that high hospital type community transmission data tracker. And if it is substantial, which is where we are now, moderate or low, masking is not required at all healthcare facilities within the county. That said, and so that was sort of the change. That said, I can tell you right now that most hospitals in Chicago are intending to continue masking. And even before COVID, as we saw respiratory season kick off, you might remember we would make a decision. It's time to sort of put the masks on in various healthcare settings. So we've been having some conversations with our hospital partners here in Chicago. Many of them have already indicated that they are, planning to maintain masking, which I completely think makes sense heading into the flu season. We have not, at this point, made a decision to do a city level requirement, given that the hospitals are sort of doing what is needed there. But if we were to get into a significant surge, for example, that transmission level would go back to high for the hospitals, and then the masking would be required again. And so, if I were in charge of a hospital, I would not be taking masks off right now, knowing that we were at substantial, knowing that winter is coming. There's a good chance high would be there. And under the governor's order, following CDC means that at a significant surge, you would require that. And so, any healthcare facility does have the right to sort of decide this is something that we're going to make decisions around. But everybody from the CDC on down recommends that, individuals in healthcare settings, who might have any potential symptoms, who have had any close contact, patients or visitors with an exposure who reside or work in a part of the facility that's having any kind of an outbreak, has otherwise had source control. Masks are important in healthcare. A lot of our most vulnerable Chicagoans with underlying conditions, cancer, on immunosuppressant therapy, they have to come into healthcare facilities, and I care a whole lot about making sure that we are protecting the most vulnerable residents. So I hope that helps kind of clarify some of where that is. I think legally we would go back to a mask requirement, you've heard me say, if we saw, if everything was moving back to a high level, we were threatening. But at the moment in Chicago, hospitals are generally maintaining it, and I think aligning with CDC is in line. Okay, so we are actually a little over time, so thank you for hanging in there with us. This is, again, if you missed the intro, Megan Cunningham, Managing Deputy Commissioner at the Chicago Department of Public Health, oversees our Community Health Bureau, which includes our environmental work. So thank you so much for joining. Any last things you want to say? Sorry, lots of COVID questions today.
No, this was a great discussion. Thank you for the opportunity to talk more about our environmental health portfolio at CDPH. I think often people conceive pretty narrowly of what it is that we do, and I hope that today's conversation helped kind of broaden the lens on the full range of activities, from data to policy work to that permitting and enforcement, and helped give some sense of where we hope we can go as a city to promote environmental justice.
Absolutely, wonderful. So thank you. Next Tuesday, we actually will not have a Facebook Live show. I am ironically going to a meeting about public health communication, so I'll probably be talking about Facebook Live there. We may do something on Thursday instead. Watch social media, and we'll let you know. If we didn't get to your questions, we will either get them next week or look to get them updated on the website. Those of you wondering if we're seeing different symptoms, are we still seeing loss of smell? We are still seeing a whole range of different symptoms. Nothing has changed notably there, but more to come next week, but probably not next Tuesday. So thank you again to Megan Cunningham. Thank you for your time, and appreciate your interest in the Chicago Department of Public Health. Stay healthy.